Hi guys, it's Dr. Bailey again. So in our practice, we have a number of different types of families, and many have multiple primary caregivers. This is just this day and age, and we love it. So in order to make it easier for us to treat our patients, this is a quick tip and trick that we recommend for everybody actually. So first off, if you can create a binder for each child, or even if you have multiple different tabs for each child in your folder, that would be great. So I'm going to tell you the things that you should have in your folder. In the folder, you want the child's physical and shot records just so that they're up to date, so that you have that. You can have different medications and dosing, just briefly. And you can have their allergies in there. But most importantly, I want some sort of blank sheet. It can be notebook paper, printer paper, I don't care. But where there's a little log, so where you can write down what happened, like if a child has a fever, if they got sick, even if they broke a bone, just so that you have something to document. So what that means is, let's say if there's an infant who's with its grandmother, in the binder, the grandmother would write down the date, the time that this child may have gotten a fever, if the child gets a fever, what the temp was, what they used to treat, and just kind of cataloging different things. This way, if anybody else comes into the office, even besides the grandmother, and even for later on, you guys have a document of kind of what happened, so that if the doctor's asking, what was given, what time did this happen? What happened after that? You're not having to play a game of telephone with talking about what transpired with your child. It makes it that much faster. You don't have to FaceTime anybody. You just have the information at your fingertips. Now, I understand if you all are saying, look, Dr. Bailey, that's ridiculous. I don't have time. Great. The next idea is use your phone, right? We have our phones with us all the time. It's a great way of cataloging information. So what I want you to do is set up a text stream with all the different primary caregivers on your text stream. So that means you could have grandma, dad, whomever. It doesn't matter as long as they're the primary caregiver. And in that text stream, you're only going to talk about what happened with that child. You're not going to get into any logistics. You're not going to really correspond on anything. It's just a document of what happens. So let's say in this case, if it's baby has a fever at grandma's, grandmother would text on the text stream the date, the time, what happened, the temperature, and what was done. And this goes to all the primary caregivers, again, so that when somebody is following up at the office or even going to the ER or urgent care, you have that information. You don't have to text somebody, call somebody to call somebody else. You have it right there for you. Now, I will say that there is a little caveat in this now, or at least other innovations. There are now co-parenting apps on your phone. I haven't really looked at them a lot. I do know that some of my patients use them. Those are also great ways to communicate, but they're also great ways to document what goes on with your child. So please look into those as well. But either way, I want you all to utilize just a primary source of communication so that you have it. It's accessible to you so that you're not hearing just, grandma doesn't have to just tell mom or tell dad or tell auntie or tell whomever about what happens. You all have the same information at your fingertips. All right. I hope this helps. For more tips and tricks, please go to our website at www.askpeds.com. You can also check us out on YouTube and, of course, TikTok as well. Take care, guys.